So thank you, and welcome to everybody. It's great to be part of this today. Thanks very much for Nicola to invite me on to speak. As Nicola said, I'm a community dietitian. I suppose I've been working for a long time in Cork with children and adults, really cradle to the grave and everything in between. But more recently, I think this year particularly, I was asked to do some inputs around the menopause. And you know, it's an area I'm delighted that we're talking about it this evening, because it's an area that hasn't been discussed openly before this year. For some reason, I don't know, is it over COVID, but for some reason the discussion is opening up and the conversation is opening up, and I absolutely welcome that. I think it's about time, and as our other speakers have said, you know, there is good help and support out there. So it's just, I suppose, realizing that it is okay to go to people with these symptoms and try and find solutions for them. And thankfully for many of them, there are things there that can help. So it's just recognizing your own body and the symptoms, and then knowing where to look for the help. So hopefully some of this presentation will help people with the food side of things today. So we're looking at eating well to be well. Yeah, I'm not going to go through a lot of this because I know the previous speakers have touched on the various roles of estrogen, but I suppose I tried to focus a little bit more on why is good nutrition particularly important at this stage in life. So the reason, as the others have said, is that the estrogen receptors are really throughout the body. So you can imagine it's hitting really every system, if you like, of our body. So the low estrogen levels really, in terms of nutrition and the kind of things I'm going to talk about, particularly we're looking at it resulting in an increase in abdominal fat. So that's our belly fat. I'm touching it here, but you can't see it. So there's a change. I suppose traditionally women tend to gain, our body fat distribution tends to be more around the hips, the bum, the thighs. This changes around menopause because of the drop in estrogen. So suddenly now the weight gain is more around the middle. There's also extra insulin resistance because of changes caused by the estrogen. And that further causes issues around that middle belly fat, if you like. Alongside that, the changes in the bone density, Kiva has related to those already, but there's quite a significant change, I suppose, that happens at this stage with a drop in estrogen. And along with that, a lot of people would have joint pain and bone pain reporting around this period. In terms of the heart health, again, this was mentioned, but particularly the decrease in estrogen actually has a result of increasing cholesterol and blood pressure. And that's generally why there's such an increased risk of heart health, I suppose, postmenopausal for women. Up until the menopause, it's actually protective for women because of our estrogen levels. But when that drops, we're losing that protection. And I suppose alongside the weight gain, that would be a further risk factor for the heart disease progressing. And it's an interesting one because we would often have people in clinic maybe referred for a high cholesterol or weight gain and blood pressure. And probably, to be honest, before I wasn't regarding the menopause or their stage in life as part of that process. And actually just tapping into this a little bit more and researching a little bit more around it, I think it's really worthwhile for all of us health professionals to be very aware of these symptoms. You always hear about the classic ones, the night sweats, you know, and the hot flushes, but really they're very common. But really the whole range of symptoms are so involving all of our body symptoms that it's really important, I think, that we recognize that. And when we are talking to clients, you know, that we do, I suppose, keep it in mind that if they're of around that age and if they're explaining these symptoms and a sudden maybe increase in cholesterol, whereas perhaps before for the last 20 years it was never an issue before, it's just something for us to keep in mind. So don't think that you're going mad if cholesterol has suddenly gone up and you're eating the same thing. It's not your fault. This is part of this process. Again, the drop in estrogen in terms of affecting nutrition-related symptoms definitely slows down the digestion. So you're talking about more constipation, more bloatedness, just more discomfort with digesting food. We spoke already about the vasomotor symptoms, so the hot flushes, the night sweats, the mood swings. Very significant, very widespread, and many of them, I suppose, are things where it's been said already, you know, we feel we don't want to bother people with them. You know, we're feeling a little bit upset, a little bit teary, but it's important to recognize that this is part of this whole process. Coupled with this, if we think about the age range that typically, I suppose, women are at this stage, perimenopause, again, the average from 45 to 55, and menopause generally from 51 up. But we're thinking then, as well as these symptoms of the lower estrogen, we also have the aging effects, which further adds to the issue. So we have a loss of lean body mass. We have a different set point in our metabolism. So our metabolism is just how our body works and ticks over every day. And that does drop. So there is a slowing of metabolism as we go older. And along with that, again, the weight gain happens as we age, and constipation tends to be something that we are more experiencing. So all of these symptoms together really can have, I suppose, quite a profound effect on our bodies. But on the positive side, they allow us then to have some level of intervention at a lifestyle stage to try and impact these points. What I'm going to do for this presentation is just more focus on the key points where there's good evidence for dietary intervention with menopause and the symptoms and the risks involved. And really those factors would be minding our weight gain, looking after our heart health, looking after our bone health. So I'm going to concentrate on those, but I'll talk about some of the other things, the popular type of foods and maybe supplements that you might have heard about for menopause. So we'll discuss those too. So the first thing to say is down the bottom of the picture there, where all those little photos are, this was after I put in a search for just in Google for diet and menopause. And you can imagine all the wild and wacky things that come back. And really, I suppose diet and nutrition is one of those things where we all eat, we all have to have food. So there's really a lot of conflicting advice sometimes about what's good and what's not good to eat for various different situations, life conditions, as well as disease states. Menopause isn't a disease state, it is perfectly normal. It's something that happens to every woman. But at the same time, there's a lot of misinformation out there about what can help. So the first thing I always say is, unfortunately, there is no one superfood that's going to cure all menopause evils. If I knew about it, I'd be rich because I'd be selling it. So unfortunately, it doesn't exist. It's basically back to a plain old simple balanced diet. And we'll have a look at a moment as to what that means. It doesn't mean the top right picture there of the lady balancing out her cakes on the scales. That's a different kind of balanced diet. But certainly, I suppose we're looking at, as well as what we eat, we're looking at how we eat, we're looking at the portion sizes, we're looking at our behaviors around meal times. You know, are we eating in a rush? Are we eating on the go? Are we sitting down watching TV as we eat? Are we consciously mindful eating? So there's a lot more than just the food that's on our plate when we think about our diet and nutrition. And also, if we're thinking about weight, remember, exercise and sleep play a really important part as well. Exercise, certainly for all of the other menopause symptoms, it really plays an important role at this stage in life. And thinking even just a 30-minute good paced walk, if we do that most days of the week, over a year, there's capacity there to lose a stone, depending on what weight we start with. So it's not that we need to be really active and going for big long walks or runs or training for marathons or triathlons. That's not what's required. We're really just talking about moving more day to day, keeping active, keeping moving, and consciously including that activity every day. So it can be the simplest things of, you know, taking the bus a little earlier, coming off, having a bit of a walk included in that, trying to walk to the shops. If there's short commutes that you normally do in the car, trying to do those if you can, either cycling or walking. But so important to manage your weight overall, and as I say, your menopausal health. And sleep as well is one of the newer things that now we associate with a factor of obesity. We know that when people don't get enough sleep, it does increase their risk of obesity, and it decreases their chance to manage their weight if they are already overweight and sleep is very poor. It all has to do with our circadian rhythm and that metabolic rate of how your body works. The main thing I say to people around weight gain at this period of life is be kind to yourself. This is normal. This is not something you have done to yourself. A lot of people will say to me, I'm still eating the same as I've done for the last 10 years. I'm active. I go for my walks. I do my swim once a week. Nothing there has changed, but suddenly I'm gaining weight around the middle. And it's just to reassure you that it's not something that you have done wrong or have taken wrongly or have not taken. It is purely a process as part of this menopause because of those hormone changes. It doesn't mean that we can't lose weight, but it's more just to accept that this is a natural process and it's not your fault. Because I think we can carry a lot of guilt with things like weight gain. So briefly, this is an image of the food pyramid. I'm sure people will recognize it. And when I say a balanced diet, this is really what we're talking about. So we're looking at balancing out our food groups, getting enough of the energy from the bottom shelves, the fruit and veg on the bottom, important again for heart health. The energy foods from the carbohydrates, the dairy foods, the protein, and the important fats. So we do need some fat in our diet, but the top shelf then are the things that we try and reduce a little. So rather than me go through all of that, there's a nice little quick 2-minute video. Music is a bit annoying. Talk a little bit about the different kind of fats when we come to the Mediterranean heart health eating. So just, I suppose that's just a whistle-stop tour. Again, the food pyramid, there's a lot of different messages within there, but I think that's just a nice way of putting it together. Those little meal plans that they showed at the end, they're actually very handy. There's about 10 meal plans where they have examples of people from different age groups, right from children up to, I think maybe about an 80-year-old is the eldest. There's about 10 different examples. And it's looking at how you would put that food pyramid into practice for those different age groups based on their dietary needs. So it's a good little way of demonstrating how the food pyramid is translated into everyday foods. So you can see there on the bottom right of the screen there, the healthyireland.ie, that website, you will find the food pyramid guide, leaflets, posters, and those meal plans per age group. So it's quite a handy one to know about. So looking, I suppose, in terms of healthy eating, we mentioned there about weight gain and looking at portions. And this is just a nice way that I think is easy to remember about portion size. So all of the food groups, there's certain portions that are recommended. But it's kind of a lot to take on board. And even when I explain it in clinic, you know, it's a lot of information. Whereas this is just a nice little reminder, I suppose, of how we're doing with our eating day to day. So the idea is, if you look at your plate, and your main meal is the best example of this. So we'll say your dinner time, if that's when your main meal is. So the top of the screen there on the left-hand side, that would be more in line with the kind of half a plate of vegetables, quarter of a plate from your protein, so your meat, chicken, fish, quarter of a plate from your carbohydrate, which would be your potatoes, rice, pasta, breads, couscous, anything there with giving us energy from carbohydrates. And on the right-hand side then is probably something we're more used to getting. Certainly with a takeaway, it tends to be a lot of meat, large portions in general, maybe not so much vegetable on the side. So just kind of using that as a rule of thumb is just a handy one to remember: portion size, getting enough of your fruit and vegetables, getting enough of your energy foods from carbohydrates, and getting enough of the protein foods without excess amounts. And that will help both with your heart health and also to manage weight. So a good little way to remember. And what I've done actually in the past with patients is even just get a little plastic plate or a paper plate, and even just draw that shape, the half down and then a quarter for the carbohydrate and the vegetables, and even just try plating out what you would normally give yourself on a regular plate. Try just putting that into the different portions on a plate, just to see for yourself, well, how far off am I from that, and just making small changes then from then. So the next message, we looked at general healthy eating, watching our weight. Feed your bones is the next important message. And we've already heard that the drop in estrogen causes that reduction in bone density and the increased risk then of fracture and osteoporosis. We know that 1 in 4 women by the age of 60 already have had a fracture due to osteoporosis. And really by the age of the late 20s is when we start losing calcium from our bones. So it's so important in the teenage years and the early 20s to get enough calcium into our diet to build up those bones, because after that stage, we actively start losing calcium from the bones a little bit. So there's a requirement to actually eat calcium every day to replace that calcium that we're losing. And I think Caoimhe had said there earlier that the menopause escalates this rate of bone loss. So about 2% bone density is lost per year once the menopause happens. It's a slower rate up until then. So to replace that lost calcium, we're looking at somewhere around 800 milligrams a day. That's if we're taking a supplement, if we don't have dairy foods. Ideally, best to get it from dairy foods because our absorption is better. So you're talking about 3 servings from the food pyramid, which is basically there, you can see in the picture. It's about, excuse me, about an ounce of cheese, a glass, about 200 mils of milk, or one of the small pots of yogurt. So roughly, you know, that's the amounts that we're talking about. They're not huge amounts. And 3 of those servings, any variety of them per day, will give you that amount of calcium. If someone doesn't have dairy, again, it's about looking at the supplement and making sure your supplement has enough calcium in it. Alongside the calcium, the vitamin D helps us do its job. Generally, we get it from the sunshine. In Ireland, not a lot of that. There's also a little bit in things like the oily fish, the eggs, red meat, and more so now the fortified products. You often see fortified milks, fortified eggs, even with vitamin D. But really, it's still a challenge to get enough vitamin D into our diets just from eating these foods or from the sunshine, which is lacking. So generally speaking, for adults in Ireland, we do recommend a supplement, particularly over the winter months when we're not getting exposure to sunshine. And the recommendation is about 10 micrograms, so that it's different to milligrams. Micrograms is what's written there, the mcg of vitamin D. That would be the equivalent. Sometimes you see vitamin D written in international units, or IU, and that's the equivalent about 400 international units of vitamin D in a supplement. For those over 65, there's actually a newer recommendation came out last year to say we need a higher dose again. So 15 micrograms for those over 65. And interestingly, actually, with the research with COVID, they have found that even higher rates seem to be more protective first of all, of getting COVID. And then if we have COVID, it seems to be a little bit more protective of decreasing the severity of the symptoms and the need for ventilation in ICU. So they've done this with studies in hospitals and finding that those where the symptoms were more severe and needing ventilation, they tended to be the ones that had lower vitamin D levels as well. So it's kind of an interesting new piece of research we weren't aware before. So it's all about the vitamin D at the moment. And just moving on then. So the next message is to love your heart. So feed your bones, watch your weight, love your heart. And again, we've seen already how the decrease in estrogen can affect our heart health at this stage. And we talk about a Mediterranean diet. Really, it just means it's healthy eating. It's a heart healthy diet. So the kind of factors there that's going to help is filling up with plenty of fiber. So your whole grains, whole grain breads, crackers, whole wheat pastas, rice. A combination is fine. It doesn't have to be that every time you eat a bread, it has to be brown. Multigrain, the whole meal, the half and half, the Be Good. So there's different options there. And, you know, if sometimes people just say, I don't like brown bread, that's okay. You'll get fiber from other things in your diet. You'll get fiber. Potatoes is one of the biggest sources of fiber in the Irish diet because we eat a lot of them. Again, if you can eat skin on the potatoes, all the better. Cutting down on fat is obviously a key part of any heart healthy diet because increase in fat increases the making of cholesterol in our body. Saturated fat is the one that does that, and that is the one associated with the full fat dairy products, animal products basically, is your saturated fat. So a reduction in overall fat, but remembering to include our omega-3 fats, which is our oily fish. So salmon, mackerel, herring, trout, sardines are a good one. Tuna, fresh tuna, or the frozen tuna do count, but unfortunately with the tinned tuna, they actually process it and they take out these good omega-3 fats. But it's still a low-fat food. It's still fine to have tinned tuna. It's just not a rich source of omega-3. The other side of the diet is just watching our carbohydrate portions. So we spoke already about that in terms of portion size. And if we use that idea of the quarter of the plate with the carbohydrate source, then that's a good guide to how much we need. And again, if you want more information, that's listed in the food pyramid as to what the different age groups. It's different for men and women. It's different for our level of activity and for the age groups, what we need portion wise. The other aspect is just looking at regular eating and not skipping meals. And again, I think that's something maybe that we can be prone to do as time goes on. Life is busy. We're often involved with children, with minding parents perhaps at that stage. So there's a lot going on, and sometimes we do tend to, again, put everyone else's preference first, feed everybody else, and, you know, no time left to feed yourself. So just having that as part of your healthy meal pattern to actually have your regular meals, 3 meals a day, snacks in between if you need it. Limit alcohol, again, obviously really important, both for the weight gain and for the risk of heart disease. So just watching our limit. For women, the recommendation would be no more than 11 standard drinks a week. So a standard drink is about a small glass of wine, about 100 mils, or a glass of beer. If we're drinking pints, you're talking about 5 to 6 pints over the week, but ideally not at the same time. So spread over the week with at least a couple of days alcohol free. So the phytoestrogens really are plant estrogens. So they're plant material that work a little bit like estrogen in our body. So the thinking behind that is that maybe they help a little bit with the symptoms of low estrogen in the body. So linseed, soya, various fruit and vegetables, various nuts are in this category. They may have a mild estrogen-like effect, but it seems to be that there's a lot of dependency and it varies hugely between people. So we need to eat a lot of them. We need to eat them frequently, about 3 times a day. And it can take a few months to see the benefit. But certainly there's some studies that show it can help hot flushes a little bit. It seems to depend on our gut bacteria, which is dependent on a good, healthy diet again anyway. Not recommended in breast cancer, and that's important because it interacts with the medications maybe people are on in breast cancer, which are trying to dampen down the estrogen activity. Other things, I suppose, that may help, certainly hot, spicy foods, caffeine, alcohol, these are the ones pinpointed for hot flushes. Certainly they do seem to have an effect on people, so just to limit those. Herbal remedies, a really quick point on those, they're not all safe. I suppose we tend to think of them as being natural. 95% of women surveyed in the menopause said that they would prefer to have a natural product rather than HRT. That's understandable, but I suppose just because something is natural, it doesn't mean that it's safe for our body. So it's just really important that if we're trying some kind of herbal remedy, that we discuss it with a health professional, and that we look at what's out there, ideally that they're regulated. The THR there, that little symbol sometimes you see, or TR and a code, which is the sign that it has a certificate of registration for herbal remedies. There's no scientific evidence as such for the role of ginseng, Chinese herbs, even primrose oil for the hot flushes and symptoms. But again, some people do find it helpful. So there's no harm in it, I think, if you do find it helps. The things there is evidence for in terms of HRT, exercise, CBT, and mindfulness. So certainly there's a lot of things that there is proven benefit. So I always say to people, do those things first. The St. John's wort, I just, sorry, saw a quick question there. So I didn't say that. The St. John's wort and black cohosh, again, there's some studies to say they may decrease the hot flushes, but again, they can interact with other medications people may be on, particularly antidepressant medications, or medications for breast cancer as well. So it's just really important that doctors are aware if you're on something and if there is an interaction. That's probably it. Just flick onto the next slide. I don't know, are you circulating the information, Nicola? Because they're only just web links, really, that's all it is.
Yeah, no, we can. We're going to just compile all the questions and the answers.
Perfect.
As well. And,
perfect. Well, I'll tell you what. I mean, I'm happy for the presentation to be shared. But if you're compiling the answers, just maybe to put those web links. That's just where to go for further information, and some really good resources there on diet and menopause. And just to say down the end there that obviously, if people do need a bit of support around the weight management or the heart health, they can ask their doctor to be referred to the community dietitian. Free service in primary care. Okay, thank you.
Yeah, thanks a million, Fiona. That was great. I always find your presentation so interesting, and always learn something new as well.
Great.
Again, just picking up on a point that you said there about, again, not being so hard on ourselves, because I suppose often enough, the minute you put on a bit of weight gain, your mind goes to, okay, I put myself on a diet, but it's about just stopping and saying, right, I'm putting it on my middle, but what else is going on for me? Is this a sign of the menopause? So it's really good to just kind of flag that as well, and to kind of bring a bit of awareness to it. And because I think sometimes straight away you can go to, oh, I need to go on a diet, and it might be very difficult to shift that weight, and because it's related to the menopause.
Yes. And I think as well, Nicola, it's so true, and I really feel it's important that we say these things, because there's a lot of kind of maybe criticism. It might be unsaid, but by health professionals, if someone is gaining weight, it's intended, it's intoned a little bit, and I think it's just important for us to be aware of that and aware of any prejudice we may be carrying without realizing it. And also just to reassure people, as you say, that it is a normal process. It is part of it, unfortunately. But it doesn't mean that you can't do anything about it. So that's the good part. Certainly we can all still look at eating healthy, maybe reducing portions if that's an issue. But it's not about going on a special diet. Yeah.
And I am gutted to hear that you haven't found that superfood, because I thought dark chocolate was meant to be one.
It tastes nice. There are antioxidants in it, so it's one of those foods. It would be a little bit like, I suppose, how the phytoestrogens work. The antioxidants again can help obviously in heart health, and can help, have that role a little bit like imitating some of the estrogen-like activity. But I think really with the research, they're showing that such large amounts are needed. It's generally, certainly in the Western diet, it's not something that we tend to eat enough of. I think there was actually one really good paper just to show the difference between Asian populations, who I think eat about something like 85 milligrams, let's say a day, is kind of their average of soya. And the average intake in the Western world is about 0.5 milligrams a day. And there is a lower risk of chronic disease associated with the Asian populations, often because of that. So yeah, there is a role there for health, but again, practically, I suppose, in the world that we're in, it's not something that a lot of people can eat enough of to give a good, a good change. But they're healthy foods, they're high in fiber, they're generally low in fat, those kind of soya foods and the phytoestrogens. So there's no harm, I think, in having them and including them.
Okay, that's great. Thanks a million, Fiona, for your presentation.